Hi, my name's Stephen Morales and I'm a proud SCAD survivor. Um, my life prior to my SCAD was pretty normal. I had I still do have a quite demanding job. I'm the chief executive of a education development institute. I'm also a very keen triathlete. I represented my country as an age grouper, so 40 to 44, 44 to 49. I raced around Europe, and very committed to my health and well-being. And then in June of this year, I was out on my bike. I was about to do a time trial. I was warming up, doing some hill reps, and I felt a funny sort of niggle in my chest and back. Nothing sinister, nothing too dramatic. Didn't really hurt very much. It was just a bit of a niggle, and I just thought it was just the position that I was in on the aero bike, which is quite a kind of crunched up position and often causes irritation to the back and the neck. So I kind of brushed it off. I carried on riding for about an hour at a reasonable level of intensity with some quite big 10% hill climbs. And it didn't get worse. It didn't get better either, but it certainly didn't get worse. And I came home. I was a little bit anxious about it, but nothing too serious. I had a nice evening with my wife and daughter. We sat outside drinking a bit of wine on a nice June summer's evening. Went for a walk with the dog. Went to bed about 11 o'clock, and I just couldn't shake this strange kind of niggle, and it was a niggle rather than anything else. But the anxiety was starting to build, and my mind was racing. And I said to my wife, "Look, I'm going to go to accident and emergency. I'm sure it's nothing, but don't come with me. I'm just going to drive myself there, and I'll have an ECG, and I'm sure they'll tell me just to go home. I've got a bit of indigestion or some muscle tension." So I did. I drove to A&E, and they did the ECG, and as predicted, they found nothing. But it's standard procedure now to give you a blood test if there's any suspicion of any kind of heart event. And I waited for about 3 hours. I was very tired. I started to get quite irritable. I just wanted to go home, and I was still pretty convinced deep down that it was nothing. And then I remember, after a long wait, being ushered into a very small room, and in that small room, I was given a glass of water, and the nurse went away, and had to wait another 20 minutes. And eventually, a doctor turned up and said the results show increased levels of troponin, which to me meant absolutely nothing. Okay, I said, well, fine. What does that mean? And then they said, well, it's almost certainly evidence of a heart attack. And at that moment, things just kind of stood still, and I couldn't really digest what had just been said to me. It just didn't stack up at all. I've had a heart attack. And I said, does that mean definitely I've had a heart attack, or there's a chance that I've had a heart attack, or what are we saying here? And they said, well, the blood readings suggest that you have had a heart attack. That's not really in dispute. It's just the extent of what's happened. And from that point, I wasn't able to walk anywhere. Well, I was able to, but they wouldn't allow me to walk anywhere, which I found quite disturbing because I felt so well and I wanted to walk. And being put in and wheeled around the hospital just wasn't. I couldn't reconcile it. And I was taken to an acute assessment area, and that was very distressing because the people around me were very poorly and in a lot of distress, and I wasn't. But my anxiety was starting to build, and I was finding it really difficult to kind of come to terms with what I'd been told. Even more so the fact that just 2 hours before I was pushing myself reasonably hard on the bike, and nothing had happened, and still nothing had happened except these blood tests were telling me that something had. And I called my wife, and she came immediately, and she sat with me, and we spent a long night waiting to be transferred to the cardiology ward. Once I was on the cardiology ward, it was quite a different atmosphere. It was much calmer. The people around me were cardiac patients who were very empathetic, and convinced, given the way I was presenting, that it was something that could be managed, and they were very reassuring about the future, even though they themselves had some very significant heart issues and some quite serious surgery. So I did calm down a little bit then, and started to kind of get my head around this whole situation, and talking to them, life after a cardiac event is possible, and actually quite a bright and full life. And these guys were a lot older than me. So anyway, the morning came, a bit of a restless night. The morning came. I was quite quickly taken into theatre, and they performed an angiogram, and that was bizarre on a number of levels. They gave me something to calm me down, which was fantastic, because, to be honest, having been so stressed out for hours and hours, that couple of hours of relief was amazing. And I was able to watch them perform the angiogram, and had the privilege of looking at the inside of my own heart. A bizarre thing perhaps to say, but actually it was really quite fascinating. And they found nothing. That the arteries were clear. There was no significant furring of the arteries. Certainly no more than you'd expect for a fit man in his late 40s. And I guess that was testimony to the extent that I've pretty much led an active life and kept reasonably fit and healthy. So there's no concerns there, no concerns with valves, no concern with the heart function. But there was, in a very, very small branch artery, there was evidence of something. And a debate ensued about whether it was a bit of fatty residual, or whether it was something called dissection. And again, after further debate, they concluded that it was a small dissection, and that was what had caused the myocardial infarction, otherwise known as a heart attack, and that that produced the troponin levels that the blood test revealed. I then had an echogram, and again, heart function was very good, no significant damage, if any. And then just given a cocktail of medication, which apparently is standard, which some antiplatelet drugs, some statin tablets, beta blockers, and aspirin, and told that a couple of those I'd possibly be able to come off within a year, but the aspirin certainly I'd be taking indefinitely. And I was okay with that. And then I guess, having been discharged, what I was searching for were some answers about the likelihood of reoccurrence, how close to full fitness would I ever get, was that possible? And the responses were vague and ambiguous at best. So as a SCAD survivor, I was told it could happen again. There were no guarantees. There's nothing we can do really to prevent it. Nothing you can do in terms of your lifestyle to prevent it. But statistically, there's about 5-10% chance, male of your age, you're presenting in your characteristics. So I've latched onto that, and whether that's true or not, 90% chance of it not happening is good for me. It feels like a positive number. I won't obsess with the 10%, or possibly even 5%, looking at things from a glass half full perspective. Since then, I've worked very, very hard with my rehabilitation specialist, a gentleman called Corey Beecher, who's been incredible, inspirational, supportive, and all of the above. And we meet pretty much every week. I feed back to him in terms of the exercise that I've been undertaking, and we do sessions where we try and push the envelope a little bit more under his supervision, which is really useful, because I feel inclined to take a few more risks while he's there, albeit considered risks. And so we've been able to get from starting off week 1, week 2, 10-minute walk at 90 beats per minute, building to a 20-minute jog 3 or 4 weeks later, getting to about 110 beats per minute in terms of pulse, And now I'm able to run reasonably freely and cycle reasonably freely and work quite hard. And I've been reaching 135, 140 in some cases. In fact, we did a beep test just a couple of weeks ago where I was knocking on the door of 150 beats, and I felt very comfortable. So every time we've challenged my physiology, it's responded very well. I haven't had any issues. In fact, I always feel calmer and more settled after my exercise sessions. I never find myself in trouble at all. And in fact, on the bike, I'm pushing comparable outputs in terms of watts and cadence and speed to pre-SCAD, but with the heart rate suppressed by the beta blockers, I'm probably about 20 beats down from where I was. So 6 months out, I think there's lots to be optimistic about. I'm pretty much back to a normal life. I do have some residual issues with anxiety and confidence, but I'm chief executive that speaks to a national audience. I regularly have to get on a podium in front of hundreds of people, and that's okay. That's working well. My energy levels week by week seem to increase, so I'm able to tolerate quite busy day, come home, do some exercise, and as long as I get a reasonable amount of rest, that doesn't cause me huge issues. And next year I'm planning to ride Alpe d'Huez, which is in theory one of the most challenging sections of the Tour de France. It's a 13-kilometre climb with an average of 8%. Again, I'm not going to try and break any records going up there. I'm going to go up in a considered fashion. I'm building my fitness so that I can do that, and I'll use the numbers to dictate the pace at which I go. And I've been very rigorous and scientific about each of those numbers, and I make sure that I calibrate them correctly. So medical advice from the cardiologist is okay, and everything that you're saying suggests that it's not a high risk proposition, and so we'll see. And I aim to do that in aid of SCAD, and for the SCAD research, I'm hoping to raise between £5,000 and £10,000 over the coming 12 months, and hoping that, albeit that modest contribution to research will help make a difference for someone. I'm working closely with Leicester University, who are doing pioneering research into SCAD. It is rare, and there's lots of unknowns, so it's important, I think, that we support this effort. So onwards and upwards. It's been a journey. It continues to be a journey. We will see where it takes us. But 6 months out, I'm feeling a lot more optimistic, and I've learned so much as a person. I've learned so much about other people, indeed, as a result of this. And it sounds weird to say it, but parts of it you wouldn't want to swap. I'm not suggesting for 1 minute that you would choose to have SCAD or anything as potentially life-changing, but on the upside, you grow. You grow mentally, and you get a new perspective, which is really important. So, for those that are SCAD sufferers, for those whose relatives are suffering with this unfortunate condition, be brave, be optimistic, live your life, and it's your life, and there's so much to look forward to.